Hello, I'm Robert, fact checker and science blogger, and helping people scared in this case of COVID-19. And we're still getting lots of pessimistic stories about 2021, how the journalists love a good, gloomy story and make everyone scared over Christmas. And that's not the situation at all. It's very, very positive. There's a lot of great stuff going on. And now, just looking at the United States, you've got to bear in mind when you look at the United States picture that basically there's no direction from the top about COVID at the moment. You can't judge Biden when he hasn't yet become president. He can't do much at the moment. And even so, the United States is turning it around. I mean, just look at it. There hasn't been a single statement to the nation telling you all to wear masks, telling you to physical distance. Trump is has given up on talking about COVID. He's only talking about his re-election, as far as I can tell. When this turns around, when we have someone who is in charge of the United States, who is saying clearly and putting laws in place, saying we've got to wear masks, we've got to do physical distancing, then this is going to turn it around. This really huge effect, it's going to have a huge, huge effect, and much quicker than you expect. This is what the situation is like in New Zealand right now. And New Zealand themselves, they were surprised at how fast it happened. And people say, oh, New Zealand, it's an island, or New Zealand, it's a rural place, it's countryside. New Zealand has a city, Auckland, of 1.5 million people. It has definitely got plenty of urban regions there. And then it's not just New Zealand shows it can do it. We have Laos, which is surrounded by, it doesn't even got a coast. We've got China, and the whole of China is like this. You don't have to do any distancing, or why does it do that? We don't have to do any distancing in China anymore. It's like that as well. And Taiwan never even had a lockdown, and most of China never had a lockdown. And the United States just hasn't tried this. They have not tried what Jacinda Ardern did, talking very clearly and directly to the American people, explaining how it works, explaining we need patience, saying to everyone you need to do your physical distancing and you need to wear a mask in a clear way that goes to the hearts of people. And constant direction like that, it needs to be reinforced over and over, explaining things clearly. Not indoctrination, just clearly presenting the science. And that's what Biden's going to do. And that's, I think it's going to have a huge difference. And the other thing is, many people don't realise how close, and these numbers, they won't mean much to you maybe, but this is the R0, I'll show you, most of you know what the R0 means. When the R0 is below 1, then that means that the cases per day are going down. If you can keep them below 1, they'll go down and down and down, even without a vaccine, as New Zealand showed. And if you can keep them below 1, if you can patiently keep going all the way down, then eventually it reaches 0 and it's gone from that country. It can't continue in a country forever if the R0 stays below 1 forever. It simply can't, it'll be gone. Mathematical thing. If the R0 stays below 1, eventually there will be no virus left. If we can keep the R0 below 1 throughout the world, eventually the virus will be gone from the world. That's just the way the maths works. That's what this number means. And so many countries, I mean, like in the United Kingdom where I live, the R0 was well below 1 during the lockdown, and it kept on down until there were only a few cases per million in Scotland. England then relaxed a bit sooner and it started going up. Scotland relaxed a couple of weeks later, it started going up. And if it kept on down a bit further, then they would have been like New Zealand. We did it with lockdown, which is a very, very difficult and expensive way to do it. You can do it without lockdown if you do your very careful test, trace, isolate, and if you get compliance. You've got to support the people who are quarantining, You've got to support the people who are isolating. You've got to constantly tell people about the physical distancing. You've got to keep reinforcing it. I haven't had a single leaflet through my door about this. How can our government expect it to work when they're just not telling people? Most people in the United Kingdom don't even really understand the point in isolation or the point in quarantine. The basic things, they don't really understand physical distancing properly. There are plenty of people who don't even think that the virus does much. I think it's just like flu. And it's no wonder, because we have these supposed experts. And the real experts on Twitter, kind of, they say, okay, this is your chance. Become an expert epidemiologist. It doesn't matter if all you've done is study bacterial infections in I don't know, Taiwan or something, or no, I don't know, bacterial infections in cattle, say. Doesn't matter. You are now an expert on COVID. Go and get yourself a slot on Prime TV and Prime Radio, and you'll get the journalists writing down every word you say and putting it on the front page of New York Times. And that's so. It is good to go to experts, but beware that there are many people who are claiming to be COVID experts who are nothing of the sort, who've never even studied this disease. And then for instance, the lead scientist, Maria van Kerkhove, go and listen to her. She has studied coronaviruses before, and then as soon as COVID came up, she was the lead team of the science team. She's been following it every day. She's reading all the science papers, all the preprints. That's her life's work at the moment, is studying COVID-19. And she has unprecedented access. Nobody else in the world, apart from her team, have such access to the direct raw data, talking directly to the scientists in all the countries in the world who are tackling COVID-19. None of the other experts have that level of access. So that is why I regard her and the general WHO science team as, above all, the go-to place to go on reliable information. And then there's some experts I follow on Twitter who are really expert on this topic area. And it's based on that I see huge hope. We know how to do this. That's what the real experts are saying. And they're also saying it's very serious. We have to do something about this. 1 in 1,000 in the United States have already died of COVID-19. 1 person in 1,000. It's the leading cause of death. And that is nowhere near the peak. On average, you'd expect 8 in 1,000, go down maybe 5 in 1,000 if you get some natural herd immunity coming in, so 30% don't actually get it. That is not something that we should let happen. And parts of the United States already have 1 in 200 have died. 1 in 200. Many areas of the United States, 1 in 500 have died in that state of COVID-19, in that city or that region. And we can stop it. So now, these are all the states that are actually bringing it down, but I say without any direction from the top. And with lots of problems accessing resources, still problems with delays of tests. They have huge problems with ICU units, because although the cases are going down, the serious cases are still going up in many places, and the deaths are going up, and that's because that's delayed by a week or 2, 3 weeks or more, can be a month delayed after the cases. Cases are going down, but there's quite a lot of delay in the ICU units. Some places just don't have. They have doctors having to come in and look after ICU who have never had to deal with a respirator, probably since maybe for a decade or more. But there's such a shortage that they have to be the one, they have to join in. You have experts having to deal with 15 patients instead of 5. That's what's happening in the United States right now. One of the best countries in terms of its technology in the world is being so stretched by this virus. And it's only because they haven't done and have had an effective response. They haven't done the right things. They haven't done the public health care. And all these people who you saw in the rallies, just not physically distancing, not wearing masks, this is the outcome of that. Turn it around, and they'll start going down. And if you look at these numbers, right through, see this 1.17, that's much lower than it was 1.3 before, and 1.25 for the highest one. I think Maine's, 1.17 is at the highest. It was Maine before at one point as well. Maine's one of the worst still increasing, sadly. But when that number is say 1.3 or something, it was 1.25, and at one point it went up to 1.3, and maybe I think that was about it. If that's 1.25, that means if you can stop 1 in 6 of the remaining transmission, then it'll start going down. That's a tiny, tiny amount, bearing in mind that you already stopped more than half from 2.5 down to 1.25, means you've halved the transmission already. And then just because it wouldn't go the extra 6th, that extra 6th is easily explained by people not doing physical distancing and not wearing masks. That enough could easily explain that. If you do physical distancing properly. And then if you do isolation properly, when you're tested, you isolate from your own household, and then you can protect your household. And then if you're tested and you test positive, immediately tell everyone you're in contact with. Don't wait for the tracers. Tell them right away. Say, yesterday, 2 days, go back 2 days, or whatever it says in your jurisdiction, it's usually 2 days. Go back 2 days. Was there anyone you're talking to close to within 1 metre, without taking the right precautions, within 1 metre, or even if you were wearing a mask, within 1 metre, for 15 minutes or more, or added up to 15 minutes over the day of lots of short sessions? If there was anything like that, contact those people yourself. Don't wait for the contact tracers. And if they go and quarantine straight away, they may have the virus in them. It does not mean they're infectious. They can have the virus in them for a week or more, usually for several days, and often for a week or even more than a week, without being infectious yet. If they then quarantine straight away, then they won't infect the rest of their household. We get so many stories. One person gets COVID-19, everyone else in their family gets it, and then some of them die. None of that needed to happen. Isolate as soon as you get the first symptoms. Quarantine as soon as you know you're a contact. You should not be isolating quarantine together with your family in such a way that they can get it. So look up the World Health Organization advice, because sadly some of the countries are not explaining this clearly. So go right to the source, go to the World Health Organization. They will tell you how to safely quarantine as best you can and isolate in your family in such a way as to have no risk for anyone else in the family. So if we look at this, we have, if we go back up there, so we look nearly all of them. It's now up to North Carolina is just steady. That's 33 states are already going down. 32 states are going down, and the rest are still going up. But they can all go down. What 32 states can do, 50 states can do. And if we go and look at this, so the case numbers remain about as high as they've ever been, but it's no longer seeing explosive growth, and many states are improving. Deaths continue to increase. You expect that because of the lag I told you about. And sadly, the worst situation is in California. If you're in California, take special care. And you can look, these are the ones going up. But look, California, it seems to have a little bit of a dip coming down now. Maybe just starting to come down. Georgia is just going up still. It's not going down. No, not Georgia, Arkansas. Georgia's going up. So those ones are still going up. But quite a few are coming down. See? Lots of them are coming down. Some North Dakota's been coming down for a long time now. Some of them have been really have put in the measures quite quickly, and then quite low, and some are low. Then you have lots where the deaths going up. If you look at the total, deaths, just beginning to level off, deaths per day, huge numbers, 2,000 to 3,000, and the hospital patients per day are still going up, sadly. And yes, it's not easy times. But if you're in New York, if you're in the United States, protect yourself. And we all, hopefully, those of you who've been following my blog, know how to do it. Physical, above all, step back. Make it absolutely routine. Don't have to keep questioning yourself. How much do I step back on this particular situation. Is this a person, or they seem to be a little bit close? Should I let them, or shouldn't I? Just always say, I'm physically distancing, step back, and step back. And nowadays everyone understands. If you say it really clear, I'm physically distancing, you become the physical distancing person in their circle. And always step back, at least a metre. If your country says 2 metres, step back 2 metres, whatever they expect. And just step back. And that by itself, well, it's to not do that is like being someone who lives in the middle of a city and just walks across the street and barely glances. You look out the corner of your eye, you just walk straight across, and if you happen to see any traffic through the corner of your eye, you stop. And the person who does the physical distancing is like someone in the street. When they cross the road, they make careful to look both ways before they cross the road. And most people who live in cities for a long time, particularly, indeed most people do this. I think especially people in cities, they get to know that you should look and check. And the cars suddenly appear from around the corner that you didn't notice. And you do have to look and not just rely on hopefully seeing them out of the corner of your eye. And just not even paying any attention, and then, oh, I just missed that one. You wouldn't just keep on, going through cities like that. So anyway, so just be sensible. Everyone needs to be sensible, and this is a very unusual virus. It is one that you can stop just by being sensible like that. You couldn't stop flu like this, because flu is more transmissible, and flu is a very short incubation period. And if you've got flu, you're probably already infectious. And that's probably why people have this idea that if you've got COVID, there's no point in quarantining because you're already infectious. That's not true at all. If you've got COVID, and if you've had been in contact with someone with COVID, then you most likely haven't passed it on. And also, it's very unusual that 71%, let me see if I can remember what that 71% was the figure for. Yes, 71% of people with COVID don't pass it on to anyone. That's more than 2/3. Don't pass it on to anyone. Even your partner, even people very close to you. That's so unlike flu. And it spreads in these rare super spreading events where suddenly you infect 20 people or infect all your household all in one go. And that event may not have happened, it most likely hasn't happened. That's why you isolate straight away, that's why you quarantine straight away. Even if you've been in close contact with other people in your household, if it's in you, but you're not yet infectious, nobody will have it, they can't have it. If you are infectious but you haven't had the super spreader event, still nobody in your household has it yet. So do the quarantine, do the isolation, do the physical distancing. The physical distancing outdoors as well as in. It doesn't matter if you're outdoors and unless even you've got a breeze blowing, just make it a habit. Because if you say, oh well, I'll judge the strength of the breeze, and if there's a very strong breeze, I'll do half a metre, and if it's a weaker breeze, I'll do 3/4 of a metre, and if it's no breeze, I'll do a metre. That's too complicated. Just always be a metre away. Outdoors or in. Step back, or 2 metres if your state says 2 metres. Or country says 2 metres. It really doesn't matter much. The WHO say 1 metre, so I'm sure 1 metre is fine. Some countries say 2 metres, so if they do, then step back 2. That's it. Anyway, so do please continue to keep safe and in the Christmas period. And if any of you, there are so many family gatherings right now, and it's quite possible that some of you will have had someone develop symptoms during your gathering. If you've been very careful, if you quarantined before, if all the people coming together are people who do physical distancing, this is very unlikely. Indeed, if you're very careful about physical distancing, it's as good as quarantining. But if you're really careful, then you can go to the shop. I don't think there are any actual examples of people getting it from going to a shop. I haven't seen anything like that in the literature, despite that being a huge focus and all the shops closing down. Many examples in restaurants, many examples in things like psychiatric wards, in refugee camps, but most of all it happens in households and your weddings and things. Most of all it happens in households. 80% of the transmission happens in households, and that's where our focus should be. The lockdown in the United Kingdom is focused almost entirely on spread between households. That's only going to stop 20% of it. And pushing us all back in households intensified the remaining 80%. Unless people are also careful about the isolation, the quarantine and the contact tracing. We should be doing that especially so in a lockdown. Sadly, our government in the UK and in the United States, I don't think they're really emphasising this. I'm sure that Biden will, when he comes in the United States, he said he's going to employ a team of 100,000 contact tracers for the United States. He's following the science. Jacinda Ardern did that sort of thing in New Zealand. And the countries that are not succeeding, Boris Johnson should get on the phone to Jacinda Ardern and say, how did you do it? And have a good long heart-to-heart chat with her and figure out how to do it here. And the same with Trump. But he's not even talking about it. He's not even doing anything much apart from supporting the vaccine. But Biden will, and I hope that he will help turn things around for everyone else. And that other countries that tend to look up to the United States. I mean, it's no wonder that people are confused in the United Kingdom when we looked at the United States and all these videos of, and they even exaggerated. You get these journalists, they zoom right in on whatever area of the crowd, and they even use this kind of, the effect of making it look as if they're close together than they are. The journalists love a gloomy story, and saying that people in the United States are not physically distancing, and then they don't pan around to where some other ones that are. And so we get the impression here that nobody in the United States is doing physical distancing, because that's the top story. They don't have stories about the people in the United States who are doing physical distancing, and many of the people I help are doing physical distancing, are extremely careful who are from the United States. It is happening there. Part of it is the journalists with their gloomy stories. We need to bypass all that, spread the news, make it clear. And that's another thing about Jacinda Ardern. She talked directly to the people. She didn't talk to the journalists. And Biden's the same. Like in the presidential debate, he stopped and he talked directly to the people, not to the person who's moderating it. And that's what you need to do. Not talk to the journalists. Talk to the people and be very clear and say this is what you do and this is why you do. Anyway, I made this rather long. They were 22 minutes, that'll do. I'll stop at this point. I'm getting some people getting a little bit gloomy about all this in the Facebook Doomsday Debunk group, and so I thought I'd say something just being a bit more encouraging and saying, we can do it, we will do it, and as things turn around, things are going to turn around. Oh yes, so we have the first vaccine. That's just such good news. First vaccine in Latin America. We have to do it in the whole world together. I'll do that as a separate video to give a bit more positive feeling to you all. See, we are getting there, and so much more positive.